So before we move on, I have a few questions I wanted to discuss with you today. I think I've been in touch with some members of your department, and before I say anything, I just want to thank CDPHE for being in touch with the City of Westminster and working with them. There are lots of concerns, as I know you are already aware, related to the use of leaded fuels in the Rocky Mountain National Airport. We have many constituents who live in neighbors in that Westminster area, Superior, and thereabout, who are very worried about lead contamination in their soil, their air, their water, and they are really looking for help. And some of the questions that they had that they wanted me to ask include some of the following, which I'm hoping we can talk about some of this. So we understand that the department is working on a more proactive public education campaign to teach people more about aviation lead emissions and health dangers. My constituents are wondering, when will this campaign be ready, and can the department provide more details on how it will be distributed out to the public? And we'd like to know which populations you would be targeting and how you plan to distribute the information. Dr. Collage?
Thank you, Madam Chairman. I would start with the issue that the current budget request doesn't actually cover a media campaign. However, we have funding available through a small grant from CDC to help provide services. We have not planned that release at this point. We're waiting for some additional testing and the completion of a study specifically around airports, which is currently in peer review. So that will better inform the issue, but we do have in the works a plan for public communication. We also have the ability to work with clinicians through several routes, one of which is a good relationship we have with the ECHO program at the Colorado School of Medicine, which provides webinar outreach education to clinicians, specifically in Colorado, but then around the Four Corners and Rocky Mountain region. So those are the issues that we have in place. And as we get information in, we can provide more information about the planning around that specific issue. I would be remiss not to point out that probably the largest contribution to lead exposure in Colorado is still housing and lead-based paint. And there are over 400,000 children in Colorado who are have the potential risk of living in homes or facilities that expose them to lead-based paint. And so as we think through the contribution to aviation lead within that setting, recognize it's not the only thing that contributes to lead-based testing. For your constituents, I would point them to our website, which has a whole section on what you can do to reduce your lead exposure and lead exposure for your children.
So, Dr. Collage, you mentioned the study that CDPHE is working on in connection with CU Anschutz. Do you know when that study is going to be ready and then how it's going to be pushed out to healthcare professionals?
Sure. So the study is in what we call peer review, and I just want to underline that that's important because that's a part of a scientific publication that has experts in the field look at your results and kind of as a third party validate that you've done it right and that the results are valid and usable. We don't control how quickly that happens, but we're hoping, hopefully within the next, I would say, few weeks. Like we're guessing, right? January, hopefully it'll be out. And again, then the distribution of the information from that we're going to fund with CDC funds. We have CDC materials that are already used to educate around lead, so we don't have to start them new, but it's thinking about how to best coordinate that. And our communications folks are working on that now.
Great. And also, we understand that Rocky Mountain, the airport is moving forward with a significant expansion, but there, I guess it's our understanding that there's no environmental impact study that's been done despite the confirmed presence of lead, PFAS, and other contaminants. We are wondering if CDPHE can have a role in this to protect nearby communities if there is impact, but people aren't doing the study. What could CDPHE do to protect people in this area?
Well, Madam Chair, I think our ability to contribute meaningfully is hampered by the fact that we don't have authority to do an environmental impact study. I think there are areas of monitoring that we already have in place. So we monitor all municipal water supplies today with CDC funding for PFAS. So we're able to address that specifically. As far as lead testing, most of our municipal water supplies, I think all of our municipal water supplies have to meet a regulatory standard for lead. And we're unaware of any compliance issues in the Westminster and Broomfield area with those, water testing. We don't do outreach for soil testing, which is another exposure source. And I think trying to figure out how we could have a logical funded system for identifying the other sources of exposure is something we're interested in. At the root of all these, though, is testing and looking at serum levels as an indicator of exposure route. So once we have a signal that there might be elevated lead levels, we're able to then dig into exposure levels, identify the levels of exposure, and help families and other individuals mitigate their lead exposure.
And I think the water contamination is the biggest concern. So I know that's something that people will be looking for a lot of support with.
And we do regulate water standards. So, hopefully Ms. Oath can talk a little bit more about that when she comes up, if she comes up.
That's great. And I do want to comment, this is something Senator Zenzinger and I are both very concerned with. We represent this area together and definitely would like to partner with the department, recognizing much of this isn't in the state's authority, but definitely working to the full extent of the department's authority to protect people and make sure that there isn't lead poisoning. So
we appreciate that, Madam Chairperson. That's exactly our intent as well.
Great. Thank you so much.